This is just an informational session on AANP and ANCC because lots of students have questions all the time on what exam is right for them, what are the differences. So, we are going to spend the next 45 minutes to an hour or so chatting about it. If you have any questions at all, you can throw them in the chat. We have Morgan in the chat. My name's Rachel. I am a family nurse practitioner and educator, and I know quite a lot about AANP and ANCC. So, really, any questions you have, nothing is too small, nothing is a silly question. Let's get into why we're all here. This is really the broad overview of AANP and ANCC, and both of them now nicely start at Prometric testing centers. Previously, and you might see this on your school pages or other areas if you look up where to test, AANP was at PSI testing centers, but they've now all moved to Prometric, which is really nice because you only have to worry about one location, one testing center. A new change as well is ANCC did used to allow in the height of COVID times, although I know COVID's spiking again, at-home testing. And as of 2022, ANCC does not allow at-home testing at all. ANP never allowed it, and they do not allow it now either. So I always prefer testing in person. I just think it left less capabilities for things to go wrong. But I do know some students prefer testing at home, especially if you live in a more remote location. But just so you know, there's no longer testing at home allowed. So to sign up for your exams, you will sign up on the Prometric testing website. And this will come along with your authorization to test or your ATT, you might see it called sometimes. It's pretty easy. You just have to know the locations near you. If you're near a larger city, you might have more options versus being in a more remote area. You might have a more remote option or kind of time constraints on when you can test. You can keep looking because testing site centers options open every day. So we have a shared testing center. There's people taking emergency exams there. People I know to become a police officer, their exams are there. All different students from all different walks of life will be there. It's not just for nursing students. Something unique is it doesn't matter what state the exam is taken in. So I know for me, I live very close to a state border, so I could take it in that state or my state. Doesn't matter at all. And that can be really nice, especially if you're limited by your location where you want to test. You can see if perhaps a close by state has more options. I've also known students who make a little vacation out of it. So they go somewhere warm, they take their test, they take a couple days in the sun. Could be nice. And a really nice thing about Prometric, and this is brand new to AANP since they're at Prometric now, you can flag, highlight, and cross out any information on the questions or answers. So that's a really nice feature, and I think helps a lot of students. I know it helped me when I was testing to just get it off the page. If I know it's wrong, I don't even want to look at it. You can cross that out. Or if you really want to make sure your brain is paying attention to something in the question or something in the answers, you can look at that with the highlight function. And you are given a blank sheet of paper. Sometimes this is called a dump sheet. This is filled in when you're at the center. I know there's some sort of confusion sometimes around when you can fill out that dump sheet. You have to be at the center. Now, some centers are very strict on when you can start filling out that blank sheet of paper, or sometimes it's a whiteboard these days. I think they're a little easier for them to track and wipe down and those sort of things, make sure nothing leaves the testing center. But either way, you do have something to write on. Some centers make you wait until your test has started. So just keep that in mind that it may cut into your testing time. Others are okay with you starting to write down your information as you sit there, but it really depends on your proctor and who's watching over you. But just plan if you're making that dump sheet to have the time to do it. I like to practice it over and over. Soothes the brain, lets you know that, okay, I know this information. I can put it down on this piece of paper and I will just look at it if I need it. So it's never lost in my brain. Testing accommodations are available. Different ways to go about it now, which is interesting because they both use Prometric. So AANP, you request through the Prometric website. So if you go into Prometric, there's a little thing for testing accommodations. This is things like if you take medications and you need to get up during your exam and take medication, to have water with you in your exam or any sort of snacks. I know some of my students have been diabetic and need those snacks during their exam, whereas normally you're not allowed to bring in snacks. If you have accommodations, you will be allowed to. Either way, you are allowed to get up and use the bathroom. Many centers do just make you raise your hand, and the proctor comes over, takes you over to the bathroom or shows you where the bathroom is, and you're good to go. The bathroom's usually inside the testing center, so it's not like you could look up information because everything's locked in your locker outside, most likely just like when you took the NCLEX. For ANCC, you request these testing accommodations through ANCC itself. On their website, they have a little area where you send the information. Most times they just want to see the letter you sent for school or a doctor's note. And testing accommodations really vary. This can be, like I said, food, water. It can be extra time. That can be huge for a lot of students. Don't feel like you don't need accommodations. If you feel like an extra half hour is just going to ease your mind, see if you can get it for yourself. There is no shame in that at all. So just some quick facts about NP. So this is the American Academy of Nurse Practitioners, quite a mouthful. And these credentials are FNPC. So Certified Family Nurse Practitioner or AGNPC. So we have two, as we know, B, C, and C. And don't let anyone tell you that just because it's C doesn't mean you're not board certified. You are board certified no matter which test you take. That is also a common misconception. But just the way the AANP denotes it, it's FNPC. Now, renewing for AANP recently changed, which I am super stoked about, because before it was a little stricter. You had to be in practice. It really was pushing some NPs away because we know, just like myself, we have moved into these other roles through education, research, clinical trials, not just being in the clinical setting. Obviously, the clinical setting is lovely and we want you there if you want to be there. But AANP recognized the fact that many NPs are in these untraditional roles, and now they've changed the renewal options. So you can have those 1,000 hours every 5 years. It sounds like a lot, but it really breaks down to not many hours. And I actually know some NPs who worked for 2 years in clinic, got their 1,000 hours, and then worked in other capacities prior to this change. So it really evens out over those 5 years. But now those years or those hours can be in patient care, administration, education. So really different routes for you. If you're feeling like, hey, I really want to teach and maybe I need to take a step back from clinic or just want to do clinic once in a while and then teach as well, that is totally fine. They're all going to count towards your renewal. Something that is mandatory for AANP is 100 CE hours. So those continuing education hours. These can be done online, in person. There are some really great conferences in some really great areas. I even think there's like an NP cruise these days where you can get these hours. The conferences often count for 60 or 70 hours. And a lot of workplaces will give you CEU money every year. So that's a really nice offering. Use that money to your advantage. Sign up for conferences you might not normally go to. There was a really cool holistic all body conference I went to at Harvard this year. And it was just really interesting to hear all the different approaches to medicine. And that might not be something I would normally do, but it was super interesting. Or even if you work in, say, dermatology, attend a conference for women's health. You never know when that might be handy, especially if you find it interesting. I always say you will get the most out of conferences or CEs that you actually like, not ones. Sometimes you got to do what you got to do, but not the ones where you're just reading some things, taking quizzes, those sort of things. Those can become boring. I would definitely encourage you to network, go to conferences, get some friends together, some colleagues together, attend together. Always a super fun time. But just keep in mind, you do need those 100 CE hours. A little note on that as well is those CE hours often can be used both for your RN renewal and for your NP renewal. So a lot of states make you renew both licenses. Hopefully, most states are like mine and they put them on the same date, but I have seen some where they are not on the same date. So just another date to keep track of, plus your AANP or ANCC renewal every 5 years. Lots of dates, lots of licenses and certifications in the healthcare field but a lot of times you can double dip and use those 100 CE hours both for your RN license and your NP license. That's a kind of nice thing. You don't have to end up doing 200 hours unless you want to. Obviously, the more education, the better. We love learning. But if you're really down to the wire, it can get a little bit stressful there. A little information about the AANP exam itself. It is still 150 multiple choice questions. That has not changed even with the switch over to Prometric. 15 of these questions do not count towards your score. Unfortunately, they don't tell you which 15, but that's a good amount of questions. If you get to a difficult one, just think to yourself, this might not even count towards my score. I'm just going to take my best guess and move on with it. That's a good amount of questions there. It's 10% of the questions don't even count towards your score. I wish they would tell you which ones they are, but I like to think they're the difficult ones that I wasn't sure about on my exam. You do have 3 hours to take this exam, so that's a good amount of time. With that being said, I really encourage everyone, and we have a great question bank for this at Archer Review, to take those full-length exams. Sit down, take 150 or 175 for ANCC questions, and see how long it takes you. See where your brain is at. Practice really does make perfect. Your brain is a muscle, and you really do have to train it to get on board with sitting there for 150 questions because it gets boring. Something I did personally is I made little tick marks on my paper every 25 questions. And then I felt like it really helped me. I was like, okay, 25 more. I can do 25 questions. That's nothing. And every 50, I really took a break, pushed myself back from my little cubicle, which you're usually in, just NCLEX, put my head down, rested. If you need to get up and move your body, go to the bathroom, grab a drink of water at the water fountain, whatever you need to do to keep your brain fresh, because we want you fresh for every single question. We don't want you burning out. An interesting thing about AANP is about 30% of the exam is on the older adult population. So this is sometimes something that comes as a shock to my FNP students because it felt like the entire exam was on the older adult population, where it's not really the entire exam, but 30% is a good amount. So this is something to prepare for. And again, in the Archer Review question bank, you can filter by population. So you can choose older adult and above to really get in on that population. And this is just reflecting the patients we typically see as FNPs. We know that the population is aging. So a lot of times we are seeing the older adults. We're not pediatric specialists, although we can see throughout the lifespan. And if you're an AGNP, we know that you are specialized in 13 and above. So the older adult really is your people. It can include non-clinical questions on your exam. This is a huge misconception from schools, from students, from, I don't know, hearsay rumors that AANP is all clinical. It actually can include non-clinical questions. So make sure you're practicing those. These are things like laws, guidelines, renewal. It can be as simple as asking what the HIP Act was or something like that. So just make sure you are up on that so you don't miss those questions because they're very straightforward typically should you come across them. A passing score, and this is where they both get a little tricky to score both exams, is 500 out of 800. However, there is no data released by AANP on how these questions are weighed. So it's impossible to say, oh, you got X amount of questions right. I wish they would just send it. I know many students wish they would just send it and say, you got this many questions right, this many questions wrong. But unfortunately, they do not. So that is the passing score. It is 500 out of 800. Who knows how those questions are weighed? But the good news is there is an 84% pass rate. So that is a really high number. So if you take anything into your exam, I want you to know that most people pass. Gosh, 84%. That is almost everyone. And if you don't pass, that's okay too. There's a lot of people who don't. And we're here to help you either way. But really take comfort in that number, knowing this isn't like a 24% pass rate. This is a good number. They just want to make sure you are a competent novice nurse practitioner. A unique thing about AANP that I really like is everyone is sent a score report. So this means even if you pass, you fail, whatever, you get a score report. Again, hard to break down 100%, but it gives you some idea where you fell. Did you get an 800 out of 800? Did you get a 502 out of 800? Just an idea. Again, if you pass, meaningless. If you don't pass, you can take some information from that and help you focus your studying. On to ANCC now. So this is from the American Nurses Credentialing Center, which is part of ANA. So you might know that from being an RN. These credentials are FNP BC, board certified. But again, either way, you are board certified. It is simply the way that AANCC and NP have differentiated from each other. No one really knows why they did this. But just so you see BC after FNP or AGNP, that means they took ANCC. If you see C, that means they took ANP. If you see both, it means they took both. Much like AANP, the renewal is every 5 years, and ANCC does still have more flexible renewal options. So you can be in patient care, you can be in administration, education, and you can also, instead of doing any of that, just do additional CE hours on top of the mandatory 75 CE hours. So say you were totally out of the game for 5 years, you could still renew your ANCC if you do additional CE hours. So it has different routes, a little more flexible, although AANP has stepped up their flexibility. For either exam also, you can't take the exam. I know most people are done with exams after they take AANP or ANCC, but that is an option. So if you're like totally out of it, not in any sense working as an NP or an RN, don't want to do CEs, you can't just retake the exams. And sometimes that's a great way if you're planning to go back into practice to really test your knowledge, beef up what you've been learning, and get ready to go back into practice. So there's tons of options for ANCC. And then we do know that AANP got a little bit more flexible, which we love. Some information about ANCC. Different from AANP, and I think what scares a lot of students away, and I totally understand it, is they have varied format questions. Unlike AANP, there's 175, so there's 25 more, however, 25 don't count. More room for error, even if there's more questions there. You do have a little bit longer, so you have 3.5 hours to do these on 175 questions. And what I mean by varied format is hotspot, select all that apply, and alternate formats. So multiple pictures to look at, those sort of things. I do want you to know that these are usually some of the easier questions. It could be just a chest x-ray asking you, what is the lower lobe of the left lung? I'm serious. They can be that easy. So I don't want these to scare you away. And the ANCC has moved away from Select All since their 2022 update. I think just to become more in line with AANP, it really feels like the two boards are trying to align, which is really nice to see because at the end of the day, you're still a board certified nurse practitioner. Why should we have two totally varied exams? 20 to 30% of the exam, they used to say 25 questions. However, they have changed this with the 2022 update. So 20 to 30% is non-clinical. This again scares a lot of people, but I don't want you to be scared by it because these are very straightforward questions typically. So as long as you're preparing, again, you know what HIPAA is, you know what autonomy means to patients, those sort of things, you are going to be golden on those non-clinical questions. And honestly, it breaks up content because you can give your brain a break. That's how I felt about the hotspot, select all that apply, and alternate format. It broke up the monotony of just answering multiple choice after multiple choice question. So again, don't let this scare you away. I know a lot of schools push for AANP and probably still do push for AANP because ANCC was once seen as the exam that more non-clinical people took, educators and that sort of thing, researchers, NPs that were going away from the clinical field, but it really is not true. I also see a lot of times that people say, oh, the listing for the job said board certified only. And a lot of times I found these jobs just simply don't know that there are two different boards. So they just write board certified because that's what they want. But they just want to make sure you passed AANP or ANCC. It is very rare to prefer one exam over the other. There was a small time where some hospital systems did prefer ANCC, but it again seemed like a little bit of a misunderstanding where they were just writing they want the BC, the board certification, but they really were fine with AANP as well. Either way, still board certified NP. On ANCC, the passing score is 350 out of 500. Again, made up numbers a little bit. No data on how these questions are weighed. They don't send us anything. They don't tell us anything about these numbers. Maybe a harder question you come across doesn't even count. Maybe it weighs more. I just want to put these numbers out there, but I don't want you to focus too heavily on them. ANCC has a slightly higher pass rate, but again, right on par with AANP, 87% pass rate, but much less students take ANCC. It's about a tenth, actually, of the students that take AANP. Again, this is who knows why, but I think a lot of students are pushed to it from their schools, or there's still that old stigma that ANCC is harder because of the select all that apply and alternative format questions. But really, the pass rate is slightly higher, although both have a great pass rate. A unique thing about ANCC is they only send your score report if you do not pass. So if you pass, it's between you and ANCC what your score was. Sometimes it's better, I honestly think, than that you don't know what it was because you can't focus on, oh, I just got a 351 out of 500. I'm not that smart, which is not true at all. If you pass either exam, you are ready to be a novice nurse practitioner, and that is really what they are testing. So, second plus time test takers, I want you to know you are not alone. Some of the best NPs I know retook their NCLEX, retook their board certification for FNPs. It is not something to be ashamed of. We all have bad days. We all go into things not 100% ready, and that's fine. We are here to help you. Your peers are there to help you. In the end, it doesn't matter if it took you 3 tries to get through or you did it on the first try. You are all going to be fantastic nurse practitioners. But there are different ways you have to go about taking the test. So the easiest way to go about it is if you fail one, you can take the other. If you fail AANP, you can take ANCC. The board of your state will never know, which I do see that question a lot. If I fail one, will the board of nursing know that I failed and do something about it? But nope, they won't know anything unless you tell them. And you literally have to check off that you want your score sent to them. So if you don't do that, they will never know the better. So if you fail AANP, you can take ANCC. No wait time, no nothing. And that's why I find a lot of students do take both exams because they signed up for both. And if you don't take your exam, you only get a portion of your money back. And so they're like, yeah, it's fine. I'll just take both, even though they passed the first one. Or they use it as a little insurance in case they don't pass the first one. Maybe they weren't ready that day. Maybe they were sitting in traffic for 2 hours and running in the last minute. It was very stressful, weren't in the right headspace. Either way, it's totally fine. To retake AANP, so you fail AANP and you want to retake AANP. This requires 15 CE hours. You can do this in any way, just like you're renewing your license. Online is usually the easiest way to go about that. Just get them done and reapply the test. You can take 2 attempts per calendar year. So that is from January to December. So if you fail once, you can try one more time for AANP within the same calendar year. Retaking ANCC has no CE requirements, but you must wait 60 days, which I'm not really sure why they do that. I think they're just hoping you clear your head, get ready to test again, study those things you need to study, have time to look at your score report that breaks down the areas that you weren't great in so you can become great in them. You can have 3 attempts per 12 months. So a little different than AANP. ANCC starts the first time you take it. So say you take it in February, that begins your 12 months. So you can take 3 times per 12 months into the next February. So just a little bit different there. But again, I believe everyone can pass their first time, but it's not a big deal if you don't. Truly, truly, I want you to know that it is not a big deal. It is not a great failure. We can help you get there here at Archer Review. And you can get there yourself. I promise you have it in you. You did the hard part, which is going through school. These exams are much easier than most school exams. I hear that time and time again that nothing was hard compared to my school's exams. So I really want you to know that although these seem daunting and a big thing, a big hurdle to get over, they really aren't. And you absolutely can do it. So now a little bit about exam anxiety, because I know these are big exams and it's normal to feel anxiety. And a little bit of anxiety is actually good because it wakes you up, gets you ready to test. However, we don't want you to tip over to the bad side of anxiety where you can't think straight. Your brain feels like this picture here, a total mashup of different information going in, going out, not sure what to do with that. So, there's a lot of reasons why exam anxiety happens. A lot of stress around the results. Will I pass this? Will I have to restart studying? Can I pass this? I barely made it through school. How am I going to pass this big exam? A lot of people also have future jobs lined up. So when I became an NP, I did have a job waiting for me. So I totally get this feeling because you're like, I don't want to let them down. I told them I could start May 1st. If I fail in April, I won't be able to start May 1st. But I want you to know that this truly is one last exam. It is one and done. Obviously, if you go on for further education, quite for you, but for most people, this is the last big exam ever. You made it through undergrad, you made it through your NCLEX, you made it through now your FNP or AGNP exam. You can do it. And like I've said time and time again, it really is just making sure you are a safe, competent novice nurse practitioner. They're not looking to know that you know every diagnosis in the world. That's just not possible and not what it's looking for at all. Some manifestations of exam anxiety that I do want you to be aware of, especially when you're taking practice exams, which I do like students to take at least 3 practice exams where you are sitting down for the full 150 or 175 questions. If you notice you're getting some heart palpitations, you're starting to get sweaty, you're forgetting basic info like what even is a systolic pressure? What does diastolic pressure mean? Or you're feeling super panicked, I really want you to think about, do I need external help for this or is this something I can control? There is no harm in asking your provider for help. I know there are some students that take different medications for anxiety, especially exam anxiety, or just talking it out with people. There's truly no stigma around it. And I would rather you go in with a solid game plan than go in thinking you can handle it when you really might need a little bit of help and then feeling overwhelmed and panicked in your exam. So, just some tips on conquering exam anxiety. And these are some things that I personally did. Write out what you know. So, use that dump sheet. Write down silly mnemonics, Mr. Pass MVP to remember your murmurs, things like that. Write down your cranial nerves. That's exactly what I did because Lord knows I was not remembering any of those Roman numerals once I got into my exam. Just simple things like that really can help you conquer that anxiety and just really reinforce that you truly do know this information. Use that paper, even if you just need to doodle something out or draw internal rotation versus external rotation. That's fine. Use it. Brain dump on that sheet so you can almost reference it and feel like at the end, oh, I basically have a cheat sheet, even though it really came from your own brain. Then some simpler ones like deep breaths. Box breathing is a really good way to go, or do a 4-second inhale, 8-second hold, 4-second exhale. Don't be afraid to be a little bit silly in your cubicle. Obviously, we're not going to be distracting those around us. The proctor will definitely not like that. But if you need to take some deep breaths or go to the bathroom and just splash some water on your face, take a break, shake it out, walk around. You do not need to know it all. And I will say that time and time again. You truly don't. You just need to know what a novice nurse practitioner knows. And if you've made it through school, you know that. I promise you, you have the information in your brain. One other thing I really do is positive self talk. One bad question, who cares? It's okay. You don't need to get 100% right. It might not even count. I want you to use your best clinical judgment, all those years of education, take a guess, move on. Sometimes you get those, what we like to call zebra questions that are just crazy, out of the blue, things you've never heard of, diagnoses you might never see in your practice. So that's fine. You can just take a break. Give it your best guess, even if you have no best guess. Pick an answer. Remember, and no answer, if you don't answer the question, it counts against you. Always pick an answer no matter what. And just know it might not count. And even if it does count, you can get a big chunk of questions wrong and still pass your exam. So these are things I really want you to think about because sometimes a lot of students who are second or third time test takers really do know their information, but that exam anxiety monster overtook their brain. It's very stressful. If you're in Facebook groups, you might see failing posts. You might see students who are like, this is the hardest exam of my life and those sort of things. And while those are valid feelings, do know that does not have to be your reality. You can prepare. Get yourself ready, make an anxiety plan, and get ready to pass, which is what we want for everyone. So now we have time for a little Q&A. Morgan will send me along anything anyone's asking. Hopefully this answered a lot of questions for everyone about AANP and ANCC. Before we get started on any questions, I do want to share that Archer Review has a great question bank. And on our question bank, we have 1,400 questions. And those questions range from pediatrics all the way to end of life. So, really good range there and really can hone in on what you need to know for your exam. So, definitely check that out if you haven't already. That's on archerreview.com. And if you have any specific questions or you want something that you don't want to ask here, you can always email support@archerreview.com and the team will send that right over to me. So if anyone has questions, you can send them through and we are always available. If you don't have questions now or if things come up, that is totally fine. I can answer some of our most asked questions. Our biggest question is, how do I sign up? And that is on the ANP or ANCC website. A big question I also get, and I know a lot of people are asking this, is can you test before you graduate? This is a very much gray area. It used to be, yes, 100% for NP, and ANCC needs something called a VOE. But for now, AANP is also asking for your school to verify that you're done your program. So technically, you can test if you've completed 500 clinical hours, which is what AANP and ANCC both require, and you've completed the didactic courses. But your school might not sign off on you testing early when you haven't completed the program. So it depends. I always recommend getting through your program and then testing, even if it's right at the end, just so you know one thing's cleared, you've moved on to the other. And we have another question. If I failed before, how will I know what to focus on? So both exams will send you a breakdown of all the different topics. So assessment, diagnosis, evaluation, plan. And it's a little bit vague, but they will put them in order of what you were best at to what you scored worst at. A really nice offering of the Archer Review question bank is you can then filter questions according to those. So say you were really great in assessment, but your plan was lowest. you can filter out for just the plan questions to focus in on what does it even mean to have a plan question. Both AANP and ANCC also have a exam breakdown on their website. And in that exam breakdown, they'll give you an idea of what they mean by assessment, diagnosis, evaluation, and plan. But if you failed before, we welcome you here and we know you will pass this time. There's any other questions? Otherwise, I can go to some of our most common questions. I do recommend always looking at those exam breakdowns on the website as well. It just gives you a really good idea of how many pediatric questions you're going to get, how many older adult questions you're going to get. It can be really insightful. Like I said, ANCC did take away the straight out 25 question non-clinical content, but it is still about 20 to 30% of the exam. Second question is, can I take the test in a different state from where I graduated or where I'm going to work? And yes, you can live in New Hampshire and take it in California. You could take a vacation and take your exam. But yes, these are national exams, so you can take them anywhere, which is a really nice offering because, like I said, if you live in kind of an in-between state area or not near a large city, it's sometimes harder to find those prometric testing centers or open time slots. So yes, you can take your exam in any state. I know some students move right after they graduate, so you could take it right before your move, right after your move. It is totally fine. And it can be totally separate from either where you live or where you graduated. There are no rules about that. Great question there. So I know it's a little different from other tests. And that being said, a little note about NP licenses is currently we do not have compact licenses like RNs. So if you do want to be licensed in multiple states, you do have to go through the licensure process for each state. Although I did see recently in an article that they're trying to push forward an NP sort of compact license, which I think will be really great, especially since a lot of remote jobs for telehealth do require, you'll see 20 licenses required, and that's not easy to license in 20 states. Just a lot of work there. So hopefully soon we'll have some sort of compact license, just like RN licenses do. Really good questions here. How extensive is the exam? So that actually depends if you are a member of AANP or ANCC. They are about 200-ish, $250-ish, depending if you're a member or not. That being said, both exams, their bodies, AANP and ANCC, do offer discounts quite frequently. So if you're about to sign up for exam, I recommend looking on their websites for any discounts and then asking around Christmas time. I know they did the holiday discount. For the spring, they usually do some sort of new grad discount on signing up for your exam. So be on the lookout for that because it is another expense. So just something you could save a little bit of money on. If you are a member of AANP or ANA, or which is ANC, you also do get an additional discount on your exam, which is nice. And I do find it beneficial to be a part of these bodies because it's great for networking. If you're a student, you can use it for precepting findings sometimes. It's a really great way to look up other NPs in the area. And it's just really nice for articles. I get their publications to my email. It just helps me stay up to date. So I definitely recommend becoming a member of AANP or ANCC. And the next question is, what classifications do I need to have before applying to take the ANCC? So they're actually very basic, which is really interesting. You have to have 500 clinical hours done, which most people have because a lot of programs require up to 1,000 clinical hours. And then you just have to have what's called your core didactic courses finished. And these are things like pharmacology, care of the lifespan, very basic classes that many graduate programs have done within the first couple courses. However, ANCC requires this thing, and you might see it called the VOE or the VOE. It is called your verification of education. That does have to be filled out for them to send you your approval to test. And that's unique to ANCC. And what that is, you fill out a lot around what courses you took, the clinicals you did, that sort of thing. And then you send it to your school. And your school should give you a contact of someone towards the end of your program where you need to send this information to. And they sign off on it and say, yes, this student did complete all of this at this college, at this program. So they are good to take their ANCC. AANP does not require that form, that VOE form. However, they have recently for test takers who wanted to test before they graduated required a letter from like your dean of your program stating that, yes, you finished all the qualifications to take your exam. So just a couple extra forms. Other than that, you do need your transcript, and you can apply with your unofficial transcript. You just won't be able to apply for your state licensure until AANP or ANCC receives your official school transcript. So as soon as you're able to request that from your school, have it sent right over so you're good to go once you pass your exam. But you can apply with your unofficial. That is totally fine to do. You'll just have to look back and make sure they get your official transcript. And then after that, you will be certified. They'll give you your board certification number. You can use that to apply for your licensure in your state. And then whatever else you need, your DEA number, your NPI number, maybe your controlled substance license for your state. All those things depend on your certification from AANP or ANCC. Really good questions here. And most states, this is also something I want to note, that most states do require you to be board certified to work. There are a few lingering out there that don't. However, they don't have full practice, so you have to work under a physician. But anyway, I always recommend making sure you're board certified. You don't know where your life's going to take you. You're already in test mode. I would definitely make sure you are board certified. But there's totally different routes state to state on what it means after you get your certification versus when you can go into practice. So some will let you, even if you don't have full board certification yet, work under a physician and they'll sign off on your notes. Some say, no, you need to have that board certification. Then you can work under a physician. Some have total full practice authority where you can work as soon as you're board certified. I know a lot of them are moving towards full practice and they have things like you have to work under a physician for 2 years or something like that. And then you can work on your own. Some states do allow you right out of the get-go to work on your own, which sounds a little stressful to me, but is also a really nice part of being an NP. For something like a PA is you do have that flexibility to work on your own. You could make a whole clinic of NPs. It's really cool and a really nice part of getting your FNP or AGNP license. And I know there's a lot of legislation out there right now moving towards full practice authority for NPs, especially because we do know that we are in a primary care crisis. Like, my goodness, so many primary cares are shutting down patient panels right now. We really can use all the help we can get. And NPs really bring that knowledge from being nurses into the clinical world of being NPs. So definitely will keep my eye on new states giving full practice authority. I know there's a lot of legislature out there for this year's vote for states on whether NP should have full practice authority. So just something to look out for in your state. And again, if you want to be an NP in different states, it will need a different license and your different requirements. So some states require fingerprints, some don't. Some states you need to work under physicians, some don't. So just things to keep track of. And one last question I get a lot is, how do I renew my license? So things that I would put in a note, either in your phone, on your G Drive, somewhere you will not lose it. One, the date of your RN renewal, if it's different than your NP renewal. If not, just the date you need to renew them both. So I know in the state I live in, it's every other year on my birthday. So happy birthday to me. Have to pay for my license renewal. Good news is a lot of jobs will pay for your license renewals, but I would keep those dates somewhere. I would also keep like your NPI number, your DEA number, those things together too, because you have no idea how often I have to look up my own NPI number. I don't know why I can't memorize it, but it's in my phone now. So at least I have it quicker than going onto the online websites and looking for it there. And once You are board certified from AANP or ANCC. That's every 5 years. So, on top of your licenses, every 5 years, you have to renew your AANP or ANCC certification. And again, there are many different routes for that you can take. Any other questions? And just like I said, we have a really great question bank here at Archer Review. I would absolutely check it out. We've worked very hard to make it very close to both exams. And we have some really exciting offerings coming this year, things that I'm super excited about. One of our core values here at Archer Review is making sure everything is accessible and not expensive for students because just like I was talking about your license fees, DA fees, even just getting through school is very expensive. So we want to get you to being NPs without breaking the bank. I want to thank everyone for being with us today. We are going to do webinars every Monday. So super excited. Next week, we will be heading into more content about HENT eyes and ears, which is super exciting. Give you a little taste of what's to come here at Archer Review and just our teaching style and give you an intro to different case studies in the question bank. So please join us next week. Tell your friends, tell your family, tell your classmates. I would love to see you. If you have any questions, you can always post them on our Facebook page, our Instagram, which I definitely would give a follow to, or email us at support@archerreview.com. So I just want to thank everyone again for being here. And we will see you all next Monday. Have a great week, everyone.